My name is Dóra Demeter. My PhD topic is about nutritional therapies in inflammatory bowel disease. In Crohn's disease, 22% of patients receive surgery in the first 5 years after diagnosis. Unfortunately, these postoperative complication rates can reach up to 30%, leading to a diminished quality of life. In our systematic review and meta-analysis, we found that 4 weeks of exclusive and enteral nutrition can reduce the anastomotic leak with 71%, and the 6 months recurrence rate with 6 months recurrent rate with 64%. Therefore, we advise clinicians to routinely use exclusive enteral nutrition. More research is needed on focusing on the components, timing, and calorie and protein needs of this enteral nutrition of this nutritional therapy. We advise policymakers to revise guidelines based on our findings. I'm Dóra Demeter, a clinical dietitian in the gastroenterology department of Central Hospital of Northern Pest. My vision is for providing better nutritional care for patients worldwide. My mission is to highlight the role of nutritional therapy in the standard of care. I have 2 projects going on. First, about the rehabilitation of IBD patients, and the second about the effects of GLP-1 analogs. Investigating the effects of exclusive enteral nutrition on surgical outcomes on Crohn's disease, systematic review and meta-analysis. Globally, around 5 million patients suffer from IBD, and in Hungary, it's 55,000. In the first 5 years after diagnosis, 22% of patients need surgery. In Crohn's disease, this postoperative complication rate can reach up to 20 to 30%. There are some promising results about the preoperative EN reducing postoperative complications, and there are some cases when even the surgery could be cancelled. Our aim is to understand whether rehabilitation of IBD patients with EN is safe and effective. Our clinical question: does EN before bowel resection improve the surgical outcomes in IBD patients? For this, we use the PICO framework, with our patients being adult IBD patients who need elective surgery. Our intervention is exclusive enteral nutrition and the standard of care, and our control is no dietary intervention, only the standard of care. Our outcomes are postoperative complications and endoscopic recurrence. Our hypothesis is that exclusive enteral nutrition is safe and surgery can improve surgical outcomes. Here you can see my search key. The first domain is about the rehabilitation, the second domain about the disease itself, and the third about the nutritional therapy. Here I want to highlight that we did search for ulcerative colitis, but we did not find any eligible articles with that. We started our selection with 8,698 articles, and after careful selection, we ended up with 11 eligible articles. With the citation chaser, we did not find any new articles. Anastomotic leakage is a condition when the bowel doesn't heal properly and bowel content leaks into the abdominal area, leading to infections. We included 8 articles with 500 patients in the intervention and roughly 500 patients in the control group. Our odds ratio is 0.29, meaning that there is a 71% decrease in anastomotic leakage in the EN group. Our results are significantly mathematically significant and clinically relevant. Endoscopic recurrence at 6 months is the first indicator, even before symptoms, of a new flare-up and the need for a more aggressive pharmacotherapy. We included 3 articles with 49 patients in the EN group and 111 patients in the control group. Our odds ratio is 0.36, meaning that there is a 64% decrease in 6 months recurrence. Here you can see my secondary outcomes: wound infection, ENOS, abscess formation, and reoperation within 60 days. You can see that all of them, all of the results favor the EN group. And here you can see as a summary how mathematically significant are all our results. Our strength is the rigorous methodology, and there were no harmful effects of the intervention. And our limitation is the low sample size, and that there were only prospective and retrospective cohorts were included, and the control groups were different in studies. You can see the progress of my first project. We finished with the figures and tables and the risk of bias. Now we are doing the grade assessment and finishing up the manuscript. Our expected submission is 20th of September. In conclusion, EN is safe and effective and was a way to reduce the short and long-term postoperative complication rate in Crohn's disease patients. Therefore, EN should be applied for Crohn's disease patients before elective surgeries. Further research should focus on the components, timing, calorie amount, and of the nutritional therapy. My second project, investigating the effects of GLP-1 analogs on disease activity and body weight in obese inflammatory disease bowel patients. 50 to 40% of IBD patients have obesity. Even though we usually expect IBD patients to be malnourished. In ulcerative colitis, each incremental increase of BMI with 1 increases the risk of hospitalization by 3.4% and the risk of surgery by 5%. Creeping fat tightens the strictures in Crohn's disease. Between 2010 and 2019, only 2.8% of eligible adults in IBD and obesity were prescribed anti-obesity pharmacology in the last 10 years. Our clinical questions: are GLP-1 analogs safe and effective in obese IBD patients for weight loss therapies? Our patients are obese IBD patients in remission. Our intervention is either semaglutide or liraglutide. Our control is no weight loss pharmacotherapy, and our outcomes is weight loss at least 5% of the body weight, and our other outcome is disease activity. We hypothesized that GLP-1 analogs are safe and effective therapy for IBD patients dealing with obesity. Here you can see a summary of my two projects. The first one I'm planning is planned submission is September of 2025. And the second one's planned submission is December of 2025. I would like to thank you for your attention with the words of Albert Szent-Györgyi. Research is to see what everybody else has seen and to think what nobody else has thought. Thank you for your kind attention.